My name's Dan Davis. I'm a general internist here in Honolulu, and I have a fairly regular general internal medicine practice, mostly primary care. A couple of years ago, I had a resident who was working in my practice, and the resident was required to have a project on quality improvement. And in that project, she had to pick a threshold that defined success. And it was suggested to her by a faculty member that she pick a threshold of, say, 70%. So I had a discussion with her about this. And I said, why 70%? Why not 100%? And she said, well, you know, I don't think I can make 100%. But I said, shouldn't that be your goal? And she said, well, I don't know, my faculty member said that I can't get 100%, so I shouldn't set my goal so high. And I said, doctor, are you willing to accept failure, that you failed your patients 30% of the time? And she said, well, when you put it that way, no, I don't want to fail with my patients. And I said, great, let's set it at 100%. Let's focus on the ones where we're not successful. And we'll use the Cozeva data to help us tell who those individuals are. We'll know how they're behaving, how often they're getting their A1Cs, and that sort of thing. And then we can work on them individual by individual by individual to try to bring them up to a more successful standard. And she presented the argument to her faculty member, who said, okay, you're not going to make 100%, but you can set your standard at 100%. And we did. And what happened was we actually targeted those individual patients. We didn't get 100%, but we got pretty close to it. And there were a number of folks in the sub-target group that we're actually able to bring up to the level that we wanted. And that was really success. So I think a valuable result from using data like Cozeva is really to, in a sense, focus on your failures for the purpose of trying to improve the health care of patients on a patient-by-patient basis. And the data allows us to do that. Cozeva's helped us manage our quality of care in my practice in a very important way, because I have assigned my medical assistant the role of Dr. Davis's quality manager. And she uses Cozeva. The more little green dots we get out there and the fewer failures we have, then I share the pay-for-performance bonus that I get with her. That provides a financial incentive for her, and she takes extra time to try to manage those patients on a personal, patient-by-patient basis. In this whole process, it's really sort of a full circle where we collect data through the EHR, up through the databases like Cozeva, and then it allows us then to very proactively manage the outcomes for individual patients, so it makes the population better, and it's certainly better for the individual patient. So that circular iterative process is really important. And where I think some practices miss the boat maybe is sort of the operational side of that, about how you actually use the data to approach individual patients. And that, I think that's a good lesson that folks can learn.